Now, if I were to ask you sudden onset, rapid escalation, pressure in the chest, tightness, burning, what is the first thing that comes to mind as a symptom? You would probably say it's a heart attack. If someone is experiencing chest pain, pressure, burning, or a squeezing type of pain that escalates quickly and is a symptom they've never felt before, they will most likely go to the emergency room anyway, because such typical complaints already suggest a heart attack. So, does a heart attack only present with chest pressure, tightness, or burning? No, a heart attack has other symptoms as well. And I can even say this. Yes, chest pain is a common symptom, but in most heart attacks, there are other symptoms accompanying the chest pain, or there may be no chest pain at all. This is what we call a silent heart attack. So is a silent heart attack truly silent? Are there really no symptoms at all? Actually, there are. Let's take a look at the symptoms of a silent heart attack together. If you experience these symptoms at any point in your life from now on, please do not neglect to call 112 or go to the hospital. As a cardiologist, I usually ask patients who have had a heart attack, what was your symptom at that moment? That's the question I generally ask. Even if they had the heart attack a long time ago, I usually inquire about their symptoms. Among these symptoms, aside from chest pain, back pain ranks first. Back pain that starts suddenly and intensifies quickly should be considered cardiac in origin until proven otherwise. After back pain, abdominal pain is the next most common symptom. Sudden, rapidly intensifying abdominal pain should also make you think of a heart attack first until proven otherwise. In other words, back pain and abdominal pain can be symptoms of a heart attack and should come to mind. The second most common symptom is a very vague one, sudden onset of cold sweating. If the environment is not hot and there is no other apparent reason, and a person suddenly starts to break out in a cold sweat, this could be a sign of a heart attack. In fact, cold sweating can be a sign not only of a heart attack, but also of heart and vascular diseases, even without an actual attack. If a person breaks out in a cold sweat with even the slightest effort, such as climbing a few stairs or walking on a flat surface, it could indicate a major artery blockage. Cold sweating is significant when it comes to heart attacks. Third on the list is sudden onset of shortness of breath. Look, there is no chest pain, no abdominal pain, no back pain, no cold sweating. Sudden onset of shortness of breath alone could be a panic attack, but if there are risk factors, a heart attack should also be considered. If someone feels they seriously can't breathe, experiences air hunger, or is out of breath, the heart should be considered first until proven otherwise. Once heart-related tests come back clear, attention can be turned to other causes. Focus can then shift to the lungs, panic attacks, or anxiety disorders. But the heart comes first. One of the hidden signs of a heart attack is nausea. Nausea, especially in women, can be a sign of a heart attack. In fact, we usually don't see the typical heart attack symptoms in women. We generally observe more atypical symptoms. Sudden onset of nausea and vomiting should be considered heart-related until proven otherwise. Why do I say the heart comes first? After tests related to the heart come back clear, other causes can be considered. Because if a heart attack isn't suspected, an ECG won't be performed. An ECG is done, and if it comes back clear, then other causes are investigated. But a heart attack should be considered first. Especially in women, heart attack symptoms appear in different ways. One of these is right-sided chest pain. Yes, pain on the left side usually suggests the heart, but during a heart attack in women, pain can also occur on the right side. A woman's heart is different. Men have heart attacks more frequently, but heart attacks in women are more fatal because their symptoms are more atypical. Especially right-sided pain, nausea, sudden dizziness, feeling faint, cold sweats. If these symptoms appear in women until proven otherwise, a heart attack should be considered first. These are the hidden signs of a heart attack. Actually, you call it hidden. You say, I never felt like I had a heart attack, but you usually experience at least one of these symptoms. Keep these symptoms in mind. Watch this video again, send this video to your friends. Everyone should know the hidden signs of a heart attack.